I'm Governor John Carney, and I'm here for our press briefing, our update on Delaware's response to COVID-19 outbreak in our state. I'm here with the Director of the Division of Public Health, Dr. Carol Route, who you're going to hear from in a moment, and our point person in our emergency response, AJ Shaw, who's the Director of the Delaware Emergency Management Agency. I want to thank both of them for their work over the last several weeks, tireless work with their teams from public health and from the emergency management agencies in our state, our local partners. In particular, thanks to our hospital partners. We had our couple-day briefing earlier this morning, conference call with the hospitals. We're making progress with respect to the information that they provide us for our planning purposes with respect to our partnership around testing, our protocols, the number of the equipment that they have to carry out the tests. And most of the reports that we heard this morning were very positive. We just appreciate so much their work. Obviously, the tremendous work of the frontline healthcare workers in the hospitals and healthcare facilities across our state, those who are working in nursing homes and long-term care facilities, a critical activity through this pandemic, protecting the Delawareans who are most at risk here. And I'm going to start with a brief update, as I do with each of our briefings, in terms of the number of positive cases, which continue to grow. The curve that we're seeing, the surge of additional positive cases and hospitalizations and recoveries, it's that bottom number of the hospitalizations that direct so much of our decision-making, the decisions that we make in conjunction with the hospitals and our partners in terms of alternative care sites, which AJ is going to talk about, and in terms of our activities to reduce the spread of COVID-19 in our communities with restrictive orders that are part of a state of emergency declaration. So as of yesterday, the number of total positive cases has grown over 1,000 to 1,116, 19 deaths to date, 177 hospitalizations. And that hospitalization rate, the number of hospitalizations compared to the positive cases, is one that we track because, as you'll see in a minute, with respect to our predictive models and our projections, that hospitalization rate is an important one to track. We've had 159 recoveries. We don't talk as much about that, but that's a real thing happening across Delaware. So how's it break down by county? 636 positive cases in Newcastle County as of yesterday. These numbers will be higher today, of course. In Kent County, 201 positive cases, and in Sussex County, 279 positive cases. It's important to point out two things, I think, now with respect to the testing and the positive cases is the test results, there's a lag. That lag has gotten with commercial labs doing the testing the results, has been a lag of as much as a week or 10 days. The reports on the conference call this morning was that the turnaround time for those test results was down to 3 to 5 days, which is a very positive, development, as well as the fact that Christiana Care now and increasingly Bay Health will have the ability to do the testing results in-house and be able to turn those results around the same day. And that's a really positive development for the purpose of managing a patient care instead of holding individuals in the hospital necessarily as a potential positive case. They're able to treat them differently and manage the caseloads a little bit. So how does the number of cases, positive cases, break down by age? You can still see that very few of the positive cases are the younger infants and children up to age 17 there, and only 26 total across our states, only 6 of which are infants to 4 years old. So the bulk of the positive cases are in that middle age group from 18 to 49, I guess broader than what most people would consider middle age, and then the populations that we focus on protecting the most, just because of the risk to a fatal condition, is 65 years and older. All of our 19 deaths so far have been in that population. I'm looking at Dr. Rattay. She's shaking her head yes. And
Yes.
in most instances, they've been with individuals who have had pre-existing bad health conditions, chronic disease, or the like. So the next chart shows you the graph, the slope of the increase that we're looking at over the next 2 weeks. This takes us out to April 14th, not quite 2 weeks. The purple bars at the beginning from March 31st up until yesterday are the actual numbers for hospitalizations, or number of cases at the bottom, hospitalizations at the top. So yesterday, again, was 177 hospitalizations and 1,116 cases. That's a 16% hospitalization rate, 16%. So it's 177 divided by 1116. And that's relevant to the charts in terms of the projections, which ramp up, which basically assume a 20% hospitalization rate to be on the conservative side. So those numbers you see there are based on that. And then the projections for the increase in number of cases increases from about 15, a little over 15% to 20% there, April the 14th. So we're seeing the surge, the increase in the number of positive cases. This is a function both of the number of tests that are done, individuals who are recommended to have tests because they are symptomatic, they've contacted their primary care physician or the helpline numbers and have been referred to one of our 7 testing locations, which are managed and operated by the hospitals in each of the 3 counties. So we continue to use these numbers, particularly that hospitalization rate, to make our decisions in terms of standing up our alternative care sites and helping the hospitals manage that surge and provide critical care, including ventilators, which is life-saving care for those individuals who need it. Next chart just is a summary of our amendments to the state of emergency declaration. We talked about all of these yesterday, April the 6th, we had the most recent amendment, which included a banning on short-term rentals and hotels, motels, except for exceptional cases, which we're working through that. It also provided guidance with respect to the appropriate measures that need to be taken by businesses that are still open. We do have, and Dr. Rattay is going to talk about this, a recommendation for individuals who, first of all, the order is still in place to stay at home, stay safe, observe appropriate hygiene, personal hygiene, and social distancing. But when you do go out for essential activities like going to the grocery store or the doctor, we're encouraging Delawareans to wear a face covering, a cloth mask, and Dr. Rattay will talk about that. There is some nuance here that you need to pay attention to. We're not asking you to use a surgical mask because we need those for the healthcare providers and the like. And this is mostly about protecting others from, infection that you might have, as opposed to the other way around. Dr. Rattay will talk about that as well. But the details there are important. AJ is going to come on in a minute and talk about our surge capacity, in particular our work with our partners up and down their state, and Dr. Rattay is going to talk specifically a bit about the outbreak that we've had in the Delaware Psychiatric Center and some of the concerns there. Some of our new testing capability will help us monitor those facilities better with the quicker turnarounds and the rapid testing. So with that kind of as a level set, I'm going to turn it over to to Dr. Rattay, who will talk about the cloth face coverings first.
Great.
Dr. Rattay.
Thank you, Governor. So Over the weekend, the CDC issued guidance regarding the use of face coverings, and yesterday the governor issued guidance that we prepared for Delawareans. So consistent with the CDC guidance, we do recommend wearing face cloth coverings in public settings, especially in places where social distancing measures are difficult to maintain, like a grocery store or a pharmacy, and for some people in their essential workplace. We want to be clear that this is a recommendation, this is not a requirement. We also really want to be clear that this is not a substitute for existing guidance around hand washing and social distancing, which are so very important. The best defense against COVID-19 is frequent hand washing, avoiding being around sick people, staying home, physical distancing, and avoiding touching your face, your eyes with your hands. If face coverings aren't used well, they actually may increase the risk of contracting COVID-19. So again, it really is important that when people use them, they don't touch them, they put them on, they keep them on, and then later take them off without touching the front of them, and once taking them off, wash their hands really well. So members of the general public are not recommended to use medical or surgical masks, as the governor mentioned. Those really need to be reserved for healthcare workers. But there's a lot of people out there looking at creative ways, making creative masks. As long as it's a tight-knit fabric, there's a lot of different options out there. And on our website, we can point you to different ways to make a mask out of a t-shirt or a scarf or other materials. There is limited evidence to suggest that the use of a cloth face covering during a pandemic can help reduce disease transmission. It can reduce the release of infectious particles into the air. So what's important here is when you wear one, make sure that it covers your nose and your mouth. We're seeing people with them on their chins or not completely covering the areas where infectious particles can be released. We also want to make sure that people have a good understanding of how you use it. I already talked about don't touch the front of it once it's on you. Once you have removed it, make sure you wash your hands. But you also want to wash your cloth face covering at least once a day, ideally after each outing or each use. And there are some settings where you're going to see more and more people in the workplace. So, for example, in healthcare settings where people aren't delivering direct care, you'll be seeing more cloth face coverings, as well as in like childcare settings. Not for the children, it's especially young children, not safe, but for child care providers, we are recommending that they wear these face coverings around children. So again, the primary purpose of wearing a face covering is really not to protect yourself, but it is to protect others. So let me talk a little bit about the Delaware Psychiatric Center. We have 5 patients and 3 staff members who have tested positive for COVID-19 at the Delaware Psychiatric Center, which is the public psychiatric hospital on the grounds of the DHSS main campus. The patients are isolated within a unit at DPC, and staff members are self-isolating at their homes. Now, this outbreak was identified through the use of rapid test kits that we talked about receiving last weekend. So as we mentioned, these rapid test kits can help us identify outbreaks in facilities. DPC is the 7th care facility in Delaware to report positive COVID-19 cases, and 5 of these facilities have multiple cases. So DPH and our sister division, the Division of Healthcare Quality, are working closely with long-term care and other licensed facilities in the state to verify that there are strong screenings and infection control and isolation measures in place in each facility, And if not, we want to assist them in implementing stronger protocols. We are very concerned about the patients at all of our state's long-term care and licensed facilities, as they are among our state's most vulnerable populations. We're also equally concerned about the staff who care for them and are working to ensure that they're aware of and implementing all relevant infection control protocols as well. Let me talk a little bit about testing. At our DPH lab, we have now tested a total of 1,670 samples. Among those, 254 are positive and 1,416 are negative. I also want to mention through the hospital community testing sites, we actually have over 10,912 samples that have been collected and tested at those sites, which is really great that Delawareans have had access to this level of testing. And finally, I want to touch base on racial disparities. This is an aspect of this outbreak that has me, as well as Dr. Walker and the governor, concerned. Now, we've looked at our data, and one thing that we have found is that for a number of our, in fact, almost half of our laboratory samples do not have race or ethnicity designated on those samples. And so a very important measure for us going forward from this point on is a requirement that any provider who is ordering COVID-19 tests must include race and ethnicity on that laboratory ordering form. It is critically important to us that we be able to have a good picture of what is happening in our state as it relates to racial differences of COVID-19. Now, many states have seen significant disparities, especially in their death data. In Delaware here, 16 out of 19 of our cases are white Delawareans and 3 are Black. So at this point, our data don't mirror what some states are seeing, but we certainly have reason to be concerned. In general, and among our minority populations, the chronic diseases that put people at higher risk for serious consequences of COVID-19 tend to be higher among our minority populations, like diabetes, high blood pressure, cardiovascular disease, and asthma. So therefore, it is critically important that we keep an eye on our data, but it's also really important that we do all we can to intervene and reach out now. We know that many people of color live in locations and housing situations where it can be difficult to social distance. We also know that we have higher numbers of minority populations or percentage of individuals who are working in the service industry, which in many cases are essential service providers right now. So as I mentioned, reaching out through existing coalitions. We have a number of partners who are working hard with minority populations to address needs in our state. Is a really important avenue for us to make sure we can do all we can to support minority populations. Through our Healthy Communities Delaware initiative, we're working with the highest risk communities across the state, and several of them have already put plans in place to better reach out to members in their community around COVID-19, whether it's testing or wraparound services. Also, the Delaware Community Foundation is operating the COVID Strategic Response Fund and reviewing applications from organizations working with these communities for issues related to COVID-19. And finally, I want to mention internally, we've sought flexibility from our federal partners to make sure that Medicaid and social services can quickly deploy benefits to people in need and keep people on their current benefits. With that, I'm going to hand it back to the governor.
And I'm going to ask you a quick question, just if you could describe briefly. You talked about, and the slide here shows the DPH lab test results with 1,670 total tested with 254 positive. If you could just explain, there's a certain protocol that you have, I think, for the testing as it fits in with our statewide testing that's done mostly by the hospitals. You mentioned over almost 11,000 tests with the hospitals. Just talk briefly about what the protocols are for testing from the state lab, if you would.
Yeah, so across all the protocols, only individuals who have symptoms of COVID-19 will be tested. Now at the DPH lab, we're testing our highest priority individuals, so individuals for whom we have the greatest concern, whether it's individuals who are hospitalized, chronically ill, first responders, healthcare workers, people in facilities like we have talked about. So most of the DPH lab tests that you see there are among those highest priority groups, because we have, over the past month, 6 weeks or so, been able to turn our tests around faster than anywhere else. Now the hospitals are starting to gain their own in-house ability to do testing and to turn it around quickly, but through the community testing sites, they've been sending out these labs to commercial laboratories, which I think some of you may know at times have taken even 10 or more days to get results back, but those results are coming back much more quickly now. As the governor said, we heard earlier today, about 3 or 4 days.
Yeah, and important to point out, too, that our efforts to assist Christiana Care through developing and producing reagent right here in our state, that they're able to do their testing in-house and turn them around, as I understand it, in the same day, as opposed to waiting for days to get those results back, and thereby allowing them to manage those patients in a more efficient and effective way. AJ, you've got a stack there as well.
Thank you. Thank you, Governor. So the governor led off with some of the projections we're looking at, some of the numbers we're keeping a close watch on, and what we're looking at now is really the hospitals. How healthy are they now, and what could they handle before we need to provide some assistance? So he talked about the 20% benchmark. We're a little bit below that right now. We feel that we'll get up to maybe about 500 hospitalizations in about the next week. This is going on those same type of assumptions. Right now, the hospitals have a relatively low census, so they've canceled elective surgeries. They've seen a decrease in emergency run volume, as we heard from Chief Logerman from Newcastle County EMS the other day. So that is good for us. That means as we get more positive tests, as more people need to go to the hospital, they have that capacity. However, we're working with the hospitals across the state. Just yesterday and Tuesday, the National Guard worked with Nemours and some individuals from Christiana Care and some public safety partners to go through some dry runs of how they will utilize the alternative care site up at Nemours Hospital. Great partners across the board with St. Francis, Nemours, the VA, and Christiana that we've seen up in Newcastle County. We have that same type of relationship down in Kent and Sussex as well. As I'm talking about preparing for this, I think we also have to take in mind and look at what the weather's like outside today. Last week was our severe weather awareness week. We're looking at high winds today. So people, we just can't be focused on the COVID. We know it's a big risk and we need to prepare for it, but we also have to make sure we prepare for other things as well. As it was just over a year ago that the community of Laurel was woken up very early by a tornado. So great partnerships as we plan here for the northern part of the state and the southern part of the state. The hospital communities are driving that themselves. We're providing assistance as needed, and it's been a great partnership. So as we talk about partnerships are going to help us succeed and get through this by providing the needed services to our citizens. This week, with the help of Public Health and United Way, who runs 211 for Delaware, we utilize that to kind of be that initial contact point for individuals that had calls to the state, whether this was related to a public health issue, they would get them to public health. If it was a call about unemployment insurance, or if they needed assistance from one of the many partners that work with meal deliveries or stuff like that, they get them over to the appropriate partner. So a great partnership there, and we appreciate United Way for their partnership and their ability to flex in the state. Food Bank is another one. Food Bank had a few pop-up drive-through delivery services over the last few weeks. I know they're working with more, but again, here we are. Individuals have lost their jobs, lost incomes, kind of that stability meal is a concern on a lot of people. The food bank and these other groups have definitely stepped up. National Guard is going to be assisting them with some drive-through services later on this month as well, so a win-win there for everybody. Dr. Rattay talked about the Delaware Community Foundation. Again, neighbors helping neighbors that we talked about all the time here in Delaware. $350,000 awarded already to 11 nonprofits across the state, and Stu and his team are doing some great work over there to really help bridge the gaps from some of these unmet needs or unanticipated financial needs that some of these nonprofits would need. And then really just to close, I think we said this the other day, but we included here something that was pretty exciting. A friend of mine from the fire service sent this picture the other day. Bay Health Fire Service down in Kent, Sussex County went to the new Bay Health site in Sussex to show their appreciation for the healthcare workers. I think we talked about that the other press conference, but we know the healthcare workers are on the front line. You talk about the stress and the anxiety that we have. Just multiply that for those that are going into these hospitals, kind of waiting for the next shoe to drop. We are doing everything we can to support them, and I think it is great here seeing the our public safety partners in Sussex County to show some outreach to them as well and show their appreciation. So we said it before. I know the governor's going to close here in a second, but we have to help ourselves. We have to stay indoors. We have to make sure we have distance between us when we're outside, and that's going to be what helps us reduce the stress off of our healthcare workers and public safety workers. Governor.
So thank you, Director Shaw, and I'm going to open it up in a minute for questions, the media that's gathered here, and we've taken some questions online that we'll address as well. But first, I'd just like to make an observation, and that is, as I woke up this morning and maybe before going to bed last night, I noticed that a report from the Institute of Health Metrics and Evaluation at the University of Washington, which is a model that's been used to predict the surge and the peaks in various places across our country, said in their most recent version with changes to their model or data based on a situation on the ground that the coronavirus peak here in Delaware has already passed. Well, that is just not true. The projections that we have and the report from today is that the number of cases has increased again from 1116 to a number much higher than that. We don't have the final number in, and the hospitalization number will jump as well. That hospitalization number, based on our experience in the past, has been around 15% or thereabouts of the total positive cases. Our projection going forward is that it will follow a 20% rate of those positive cases. And so we continue to see the positive cases going up. We know that we're doing more testing, so some of that is a function of doing more testing. The results that we get back have been a little bit lumpy because of the delay in getting results from the commercial labs. Now we're going to get results more quickly from the hospitals themselves who are doing those tests and processing those tests, and also from our public health laboratory. So we still have a lot of work to do to prevent the continued spread of the coronavirus here in Delaware. And so our message today is the same that it's been for weeks now, which is stay at home. We have a stay-at-home order in effect. This is a religious holiday weekend, Passover starting last night, and Easter celebrations through the weekend, and we would ask everyone to observe the directives of the order and to celebrate and commemorate these religious holidays and traditions, but do so in a safe way with your families. Continue to practice basic hygiene, hand washing, making sure you're wiping down surfaces that are utilized a lot. Protect your neighbors by avoiding going out of the house except for essential activities, which includes a nice walk in the fresh air by yourself or with somebody who's 6 feet apart. Your actions affect your neighbors, and your neighbors' actions affect you, and we'll be able to save lives if we're able to do that together. So I want to wish everyone a holiday, a good holiday over the weekend, and we'll take some questions from the media now. Esteban.
Esteban Parra, the News Journal, Delaware Online. Governor, thank you. Based on a story that we ran earlier this week, it seems the feds have not delivered enough PPE supplies to Delaware. Is the state getting it from somewhere else? If that is so, I'm sorry, if we do have enough, why did we ask for more than we got needed?
So I'm going to let AJ handle that, but just a general sense to put it in to put our state perspective in the context of the national perspective. And as governor, I participate in our, I guess they've been twice a week or 3 times a week, phone calls with the White House Task Force headed up by Vice President Pence, and the issue of PPE and needed equipment, from testing equipment to the PPE to ventilators and the rest, comes up. And different states are experiencing a surge at different times. We're seeing the surge in greater New York City right now. There's been projections about where it's going to happen next. And so some parts of the country need this equipment more than others. And we've heard on these calls where they've put in charge a Navy admiral who's directing the supply chains to the areas in the country where they need it the most. In our discussions with the hospitals this morning, that question came up: how's everybody doing with equipment? And by and large, with the exception of certain testing capability, in particular with some of the downstate hospitals, BB, with a reagent that they don't have as part of their testing kit, we're in pretty good shape, but we're working on getting those supplies through our own supply chains. JJ?
No, I think the governor did a good job. It's a multifaceted approach. So yes, we've received some equipment and PP from our federal partners. We have requested more from our federal partners. We are utilizing our contracts, our vendors, to go out and get some more. So do we have everything we need? No. There's some items that we have less than probably a 5 to 7 day supply of in the warehouse at this time, knowing, for example, the hospitals across the state, the daily burn rate right now just for the face mask, so the surgical face mask, not the N95s, is in the 60 to 70,000s at times. That number could go up. As the hospitalization goes up, we're going to use more PPE as well. So we have requested more from our federal partners. It's about a 10 to 14 day capacity that we requested from them, and our partners at the Office of Management and Budget and GSS are working diligently to source stuff, and we get confirmations on some stuff, but then I guess there's other parts that we're not confident on when it's going to be delivered. So everybody's asking for the same stuff right now. We know that there's been bidding wars at some level, so somebody says we'll have it, and if they say we're going to have it in 7 days, I'm going to believe it at 7 days when I see it. It's not like it's an Amazon Prime package that I'm pretty good is going to be here by 9 o'clock tonight. So I think we are being very realistic. I answered a similar question the other day where, as getting Delaware prepared, I want to have as much stuff as possible, but as a human being, we have to look at the big picture. 50 states across the country and territories in the world are going through the same process right now, so we want to make sure we're the backstop. We've provided guidance to our public safety partners to go out and try and execute any contracts they can to order it as well, because if we're looking for 300,000 or $1 million of something, they might only be looking for 10 or 15,000. They might be able to find that through one of their normal vendors. So we're not out of the woods with anything we've requested yet. I will say we are having a little bit more success. I know we ordered enough gloves today that I believe will last us about another 7 days. But it's going to be 7 days before we know it. It's going to be next week, and again, we're going to replenish it. So it's a constant process. The hospitals, we've gone on some bulk orders with the hospitals to be able to get the attention of maybe some bigger manufacturers and bigger orders. So we're approaching it from multiple angles, and I think we are at the same time we're trying to be as responsible as possible in making sure we don't have equipment here that we don't need at this time.
And that's fundamentally the question, Esteban, which is what's the need? How many do you have in-house, and what's your burn rate? Meaning, how long is that going to take you? And as we talked about testing this morning, most of it was supplies to accommodate a 2-week burn rate at X number per day. Some hospitals had a little bit more than that, as I recall. And it's something, in each case, they have an order that's pending. And if the orders keep up with their burn rate and their current supplies, then they'll be okay. If they get intercepted, as we've been hearing a little bit, then maybe it's a different story. So as AJ said, we don't count these equipment in the house unless we've seen it arrive because of that.
Second question. We've seen other states and cities larger than Delaware provide a specific number of cases per zip code, in some cases neighborhoods. Some states provide exact age and recent travel that person may have had. Is the decision not to go into that amount of detail here down to the law, or a judgment about what is helpful and responsible?
Yes, so great question. I'll let Dr. Rattay address it, and I'll just say briefly that, with Delaware, in all of these public health kind of issues, we have the challenge of small numbers, where small numbers can move things one way or the other, and importantly, identify individual cases in terms of HIPAA restrictions. So we've tried to make available the data that we have vis-a-vis county numbers and so on that would be meaningful. There are some maps up on the website that indicate kind of heat maps where the concentration of more cases is than others. We ran into this years ago, if you remember, with our so-called cancer clusters question and how much you could identify and so on and so forth. And so we're trying to provide as much transparency and as much information for the public geographically, because people want to know, is it close to where I live, and do I need to be concerned about that? Dr. Rattay?
Yeah, it's always a tough balance. We want to get as much information as we can out there. On the other hand, we want to protect people, and our law requires that we protect people. We also know that if people can be identified, especially in a situation like this, they can be stigmatized, and that's prohibited by law. Different states, different health departments.
I'm sorry, Delaware law or federal law?
It's a combination. So Delaware law is tighter than other states and other cities as it relates to transparency with numbers. That's something that could be addressed in an upcoming legislative session here, but we work very closely with lawyers to determine what we can release without violating the law. But as the governor said, it is really important to us to be as transparent as possible. We want to get the information out there.
Other questions?
Next question comes from Amy Cherry at WDEL. Governor Wolf announced today that schools in Pennsylvania are closed for the rest of the academic year. Governor, are you going to make a similar move, or when will you be in a better position to decide on that?
Yeah, so my focus on the school question and the school closing question is really to try to get all the districts, the teachers, and educational personnel in our state to focus on using the time now when they're not officially in session, they're not at school, to use it for effective instruction, helping the children, the younger children in particular, making sure they're getting reading material. I was talking to a young freshman in high school just the other day about what they're doing in the high school that he goes to, and he's doing his homework, and they've got work going on during the day. I'd like them to focus on that, because this time these children will never get back, and I really want them to kind of lean into making sure that they're providing as much instruction and content material as they can for the period of time when they're closed. I don't think we're ready yet to make it that determination. We don't know when the peak's going to go or going to happen. Obviously, one of the things that we do, and one of the things that I do, is consider what's happening in other states for lots of different reasons in making that decision. But right now, we're not ready to make that decision. We'd like our schools and our school districts to really lean into making sure that their children are getting instruction between now and whenever the school year ends, and to also think about what kind of activity and educational experience they can provide and encourage over the summer months as well and into next year. So lots of questions that need to be answered there, but we're not prepared to say yet that school will be closed for the rest of the year.
The next question comes from Jose Somalo at Oy in Delaware. He says, we've heard from the Hispanic community working at chicken processing plants that they may have several coworkers coughing or not feeling well. How is the state coordinating and helping the chicken industry in providing optimal health conditions at poultry plants?
So as we all know, we've had a positive case in the Purdue plant in Milford, as well as the Mount Air plant in Selbyville. In both cases, Public Health sent out an investigator to look at the situation there, to observe and learn about the protective measures that the employer was using, and reported back. In both cases, they felt like what they saw there at the plant were appropriate protective measures. One of the concerns that I have, frankly, as a result of those two cases, was not so much the effect in the plant. So I think, given the report that I heard from that investigation, was that they were providing appropriate measures to keep workers separate. Actually, we're talking about putting plastic shields in between them. They wear protective gear normally. But their comings and goings in automobiles, where the communities in which they live, in Georgetown, Selbyville, the smaller towns in Sussex County, Milford, and we are engaging a group to work with nonprofit and local social service agencies to reach out into those communities to get the word out about appropriate hygiene and social distancing during this time, so we don't have an outbreak in those communities. And they will continue to work with that engagement, particularly outside of the plants. I feel more comfortable about the conditions inside of the plants with the protective gear they have. There were some issues there, again, with coming and going, but more concerns, I think, with individuals and families in their communities. I don't know if Dr. Rattay wants to add to that.
Yeah, no, I mean, it's been a nice partnership between DEMA, DPH, Department of Agriculture, and the poultry plants to ensure that they are doing all that they can to screen the workers and to ensure, if they're ill, that they are not coming to work. And then also, as the governor was mentioning, that they can social distance while they're at work. And we know that it's not easy, but they're working very hard to be able to protect their employees.
And one of the important things, they were doing temperature checks as people come to work to make sure that they don't have a fever.
This next question goes back to the personal protective equipment. It's from Randall Chase at the Associated Press. I think it's in reference to some documents that came out from the House Oversight Committee. Why did Delaware request such huge amounts of PPE from the Strategic National Stockpile while other larger states with more severe coronavirus problems are also in need of those supplies?
So it was a question we researched a little bit, and if you look at that number, I believe that 100 million gloves that were looked at one time was kind of a request based on a 120-day burn rate versus like the 10 to 14. So, we did not get that. We, went back and reevaluated what we need. We're providing updated, burn rates to our federal partners just about every day. And from there, that's where we then recalibrated and re-requested stuff based on a 10 to 14-day burn rate, with under the same assumptions I mentioned before. As the hospitalizations go up, we know the hospitals are going to start utilizing additional equipment as well.
The next question comes to us from George Shea at Delaware Newsline. He asks, in spite of your office and the Department of Health promoting and encouraging Delawareans to get out for exercise, what are your thoughts about the city of Newcastle shutting down Battery Park to non-residents that was announced sometime yesterday and made effective today?
Well, what I know of Battery Park, and I know it pretty well because it's where my wife grew up, nearby there in Old Newcastle, and where her mother and father lived after she moved away, is that's an incredibly nice place to spend time outside and get a nice walk in. I'm not familiar with this particular order, whether the definition of resident or non-resident relates to whether you're a resident of Newcastle or a resident of Delaware. With respect to the resident of Delaware question, we have a quarantine requirement now for non-Delaware residents that are traveling to Delaware to quarantine for 14 days if they come here. And so that's part of our emergency declaration. We've tried to be direct, respectful, but serious about the enforcement of that. It particularly affects communities near the border and mostly retail establishments there, particularly in the northern part of our state, not so much a place like Old Newcastle. That tends to be people that come in from the surrounding areas to use that as a place to get some fresh air and some exercise. So that's something that we encourage, actually, unless it's creating a problem with social distancing, and knowing the Battery Park as I do, that could be a significant problem out there with people coming in from all over the county and beyond to enjoy that wonderful park.
Dr. Berte, again, it's Esteban Parra with the News Journal. You don't really know me. I'm not the sharpest pencil in the box. So could you explain to me a little bit more about why we've not been doing the race and ethnicity? I mean, what happened there that some people were doing this and some people weren't? And who are some of these folks that were, what was happening? In a little bit more detail than what you gave earlier, please.
Sure, happy to. So, we capture race and ethnicity in our public health data in a variety of ways, but when it comes to our cases for COVID-19, we're capturing our cases through laboratory diagnoses. And so the laboratory, the information that's coming in from the laboratories, which is, you can see now, is well over 10,000, half of the time the ordering providers did not put race or ethnicity in the ordering information, and therefore the data we have, we don't know how right or how wrong it is because we're missing so much data. But as I mentioned, knowing this now from this point forward, it is required that that information be put in those laboratory order forms so that we can have a clearer picture.
And it's important to point out, this is important and necessary information to have for lots of different reasons, not the least of which is that we know that, as Dr. Rattay mentioned earlier, that there are health disparities that exist in chronic diseases and the social determinants of health and the rest. We did raise this issue with our hospital partners on the call this morning, and got very positive input from them that this is information that they'd like to provide for us, and they will do that. So going forward, we will have this information to the extent that we can reconstruct it from tests being done. We will attempt to do that. What we do know is that out of the 19 deaths so far, 3 have been persons of color.
And this starts today, or started today, or does it start tomorrow, or?
Starting today.
And it's that simple. You just say, hey, guys, we need this information, and they could just start checking it off.
Yes.
All right.
The next question is from Jeff Cole at Fox 29, who asks, what are your thoughts on the Trump administration's claim that it's concerned the Philadelphia area, including parts of Delaware, are the next hotspot? Are they wrong? Are we seeing different information than that?
So I don't know if Dr. Rattay or AJ has a different perspective on this, but as we look at what's happening across the country, as these peaks tend to go in waves in different areas, I, for one, have been paying attention to that and thinking through the different measures that we need to take here in Delaware, and I think each of us has been doing that as part of our work. We know that first big wave was in the state of Washington, and in particular when they had an outbreak in a nursing home and so many of those residents died. We know what is happening now in the state of New York and Metro New York City in terms of that wave. And we've heard that there are waves coming. Philadelphia, Washington, D.C., Baltimore, metro area has been mentioned. Northern Delaware is part of the Philadelphia metro area, and so I'm sure is included in their evaluation, in their calculation. We look at the numbers as it relates to the state of Delaware. There is some bleed out into Pennsylvania because Christiana Care's catchment area includes parts of Chester County, Cecil County, Maryland, and so they have some patients there. So do we think that we could be affected by what's happening across the line? Absolutely, which is why some of the measures that we've taken, in particular the order to stay at home, shelter in place, traveling bans have been implemented, have been put into effect just for that purpose, for protecting our area, our state, from spread in our region. People have connections, family connections all over the state and across state lines. Our enforcement efforts at the border were intended in part to address just that issue. Whether or not they're going to be next, there's been some comment among the experts that we're a couple weeks behind Philadelphia. I guess based on our predictive model, if their peak is coming or now, we think that we might be a couple weeks behind. So that would, what we, I think, know is that the observation that we started off with, that the model from the Institute of Health Metrics and Evaluation, that our peak was yesterday, is not accurate. Dr. Rattay?
Yeah, I mean, this virus is clearly unpredictable and challenging, but I can say that I believe that the governor has taken a very strong approach to mitigation and social distancing. And I also think we're probably one of the only states in the nation that's still doing contacting positive cases and providing follow-up of those cases. And so I believe we're doing all that we can. You know, I really appreciate Delawareans abiding by social distancing, and that's really what's going to make the difference. But clearly, there's unknowns.
Kevin Andrade at the Voice Radio Network says that thousands of Latino workers are part of many businesses considered by the state as essential during this emergency. For instance, landscaping, construction, food trucks, and many others. Would you consider closing some of these businesses for 2 weeks in order to slow down the advance of coronavirus?
I've said time and time again that if we see industries and businesses that are not abiding by the appropriate, by the orders and implementing protections for their workers and for the workers' families and other Delawareans, that we will consider shutting them down. We're not there at this point, but I get reports on a regular basis about inappropriate activity happening in each of the industries that you mentioned, and it is, yes, a concern of mine.
Our final question comes from Laura Ritter at the Cape Gazette. For the safety of people who live in Delaware, do you recommend that hotels and people who rent their homes should continue accepting reservations for June, July, August, and going forward?
Well, one thing that I've learned about this, and I'll ask AJ and Dr. Rattay to comment as well, is that we can't be certain about what's going to happen a week from now, let alone 2 or 3 months from now. The further out we get, I think the more uncertain we are about the numbers. I would have been delighted to be able to come in here today and say that our peak was yesterday, or that I think our peak's going to be tomorrow, or that I even think that the peak is going to be next week. I think one of the questions that we're all struggling with is, where is that peak, and how will we know when we get there? And more importantly, how will we know on the other side of the peak, and when we can take off some of these very, very damaging restrictions to our economy and people's way of life here in our state and our country. That remains a very difficult and important question for all of us. Just on our conference call this morning, I asked our team to have folks thinking about that on the predictive modeling team, on those who reach out to the best science on this pandemic and what the experience has been around the world. Obviously, we've seen, and you're seeing today, the reaction of China with respect to their going to back to work orders and some questions about that. And so we're going to try to make the best decisions that we can based on the science and the data that we have in front of us, and not make any long-term predictions about when anything will be able to do anything, and I'm certainly not prepared to do that this morning or this afternoon. Dr. Rattay and AJ just said they agree. I think that's the way I'm going to interpret their head shaking. Well, again, I want to thank the media for coming out again and allowing us to provide this update. It's an update for the people that we work for, the citizens of the state of Delaware. We are conscious of the fact, as per many of the questions, that we are part of the greater Philadelphia region here in the northern part of our state, and part of the shore region, eastern shore, Maryland, Virginia, and Delaware in the southern part of our state, and we're making decisions based on the relationships with our neighbors. I just wanted to reemphasize our advice for the last month or so, particularly since the state of emergency declaration and the order for everybody to stay at home, to practice basic hygiene, to protect your neighbors by thinking about your neighbors and not being casual about social interactions outside of your home when you go to the grocery store. We're recommending now that you wear a cloth mask. I got my Eagles cloth mask ready to go, and I'm learning how to put it on. And when and if I have to go to the grocery store, I will make sure that I put this on, as we're recommending all of the Delaware citizens to do, but to do it thoughtfully. We're not saying go out and get a surgical mask. We have great competition among our first responders and our hospital personnel for those masks. We're not saying that in all circumstances you need to wear it, and it is a recommendation, but the more I travel around in the car, I see more and more people who are wearing masks, which signals to me that they're conscious of the risks out there, and I think that's a good thing. And finally, I just want to wish this is an important religious holiday this weekend, one of the most, if not the most important religious holiday in certain traditions of my own, and I just want to wish everybody a happy Passover and happy Easter, and ask you to be safe in the celebration of your religious belief and the traditions that you hold dear. So thank you very much.